Welcome. My name is Dr. Shireen and I'm a GP from London and a mother of one, and have experienced firsthand the impact of RSV when my son fell ill with a lower respiratory tract infection as a baby. Most RSV infections in babies are mild and clear up on their own. However, some cases can be more serious and require hospital care. Sanofi has launched Together Against RSV, a disease awareness initiative that aims to educate parents, expectant parents and caregivers about RSV in infants. The goal is to equip parents with the information they need to better spot the signs and symptoms of RSV-related illnesses. In today's episode, we'll learn more about what RSV is, some of the main symptoms to look out for, how to protect infants from infection, and when to act and seek medical advice. Our panel today includes Professor Paul McNamara, Professor in Child Health at the University of Liverpool, social media influencer and parent Amber Wild, and Christine Burlinson and her husband Tom, parents to daughter Aria and son Jude, who both had a lower respiratory tract infection caused by RSV. It's great to have you all here on today's episode. Thank you so much for joining us. Professor McNamara, perhaps we could start with you. Could you please provide us with a brief overview as to what RSV is?
Well, RSV stands for respiratory syncytial virus. It's a very common respiratory virus. It causes, for adults, we get infected with RSV every couple of years. Most children do as well. It doesn't tend to cause problems in older childhood, but it can cause real problems in preschool children, and particularly babies, and particularly those less than six months of age, where it can cause a condition called bronchiolitis, which is inflammation of the smaller airways in the chest.
Okay. And Christine and Tom, I expect that some of this might sound familiar to you. Would you like to share your story and your experience with us?
Yeah, so our firstborn daughter, Aria, we got home from hospital and she was about 6 days old when we got home. And quite soon after that, we noticed she had what we thought was a little bit of a cold, and she struggled to breathe through her nose properly and was a bit coughing and wheezing, but we didn't think too much of it because we just assumed it was a cold. But a few days later, we noticed that she was really struggling to breathe through her chest, and she had what we now know chest recessions when she was really sucking in. And we visited the health visitor who kind of showed us videos of what we should be looking out for and when to get extra help. And it was actually when she was 12 days old that we phoned 111 after she looked like she was really struggling to breathe. And she had an episode where she went from crying a lot to just sort of passing out on my shoulder. And when we explained this to 111, they sent an ambulance straight away and took her to hospital, where we stayed for a further 7 days. And she was diagnosed with bronchiolitis, as you just said, and needed oxygen to help her breathe. So yeah, we stayed within a hospital for 7 days. That was our experience before she started to improve.
So Christine, you mentioned when Aria was unwell with RSV, the doctors told you that she'd developed a condition called bronchiolitis. Professor, could you tell us a little bit about the link between RSV and bronchiolitis and what the difference between the two is?
Well, RSV is the commonest cause of bronchiolitis. It accounts for about 70% of cases of bronchiolitis are caused by that particular virus.
So obviously having an unwell child is a really, really stressful thing for any parent to go through.
I think that very first day when we were admitted to hospital was the worst, because I don't think we thought that we would be even staying overnight, let alone staying a week. So when she was hooked up to the monitors and when she had oxygen going into her nose, that was when it really kind of hit home that she's really not well here, and that was really worrying and really concerning. And I remember my mum just carrying her while she slept, because she didn't like to sleep in a bed. She always wanted to be on us, which is understandable when you're that little and you're not well. And my mum just said, it really seems like she's just struggling to breathe, and she couldn't have said anything worse at the time, because that's just your worst nightmare, isn't it? Worrying that your little newborn baby can't breathe properly.
And did you know what RSV was before she became unwell? Had you ever heard of it before?
No, not at all, had we?
No idea. And yeah, like Christine said, we just kind of assumed it was a cold or sort of cold-like symptoms. And I suppose being the sort of the male, I was trying to maybe gloss over and everything was okay, but actually Christine sort of came in and said, no, we need to act now. And thankfully she sort of did it in time, really, because I wouldn't like to know what maybe would have happened if we hadn't acted at that time, because she was regressing quite quickly.
You mentioned the health visitor saw her and then 24 hours later she was blue lighted to hospital. Professor McNamara, is it quite common for children with RSV to progress quite quickly and deteriorate?
It certainly is. If they're young babies, they can get sick very, very quickly indeed. Older children less so, but young babies particularly can get really, really very sick, and they can struggle with their breathing. They often struggle with feeding, and I don't know whether that happened. They can get temperatures and things like this, but yes, they can have pauses in their breathing as well. So it's really can be a really frightening condition, particularly for first baby, only a few days old.
I think it was the breathing that was the most difficult, because we had no idea what newborns were supposed to breathe like, so we didn't know what normal was. So when we were looking for the signs, that was the most difficult thing, because we didn't know what her breathing pattern was supposed to be like.
Absolutely. I mean, children typically, they have higher respiratory rates or breathing rates and heart rates than adults, don't they? So knowing what's normal, I suppose, is really important so that you can then pick up on any abnormalities. So she went to hospital, she was there for 7 days. Was she in ITU there, or was she on a normal ward?
Yeah, she was just on the normal children's ward, just being monitored. So she was given oxygen the whole time just to help her breathe, and monitoring sort of her feeds and whether she was sort of doing the normal passing wheeze and poos.
Okay, and then her recovery after that, when she was home, did she come home completely back to normal, or was there sort of a little bit more recovery?
I guess it's hard to say again at that age, because you don't really know what normal is when they're sort of 2 to 3 weeks, but I think so. As Christine alluded to, we were in there for 7 days and they sort of tracked her oxygen levels, and we weren't allowed to go until we reached a certain threshold. I was very aware of her breathing and sort of nervous when she didn't breathe normally, let's say, or regularly, but obviously, as the sort of professor alluded to, I think when they're at that age, their breathing is kind of more irregular anyways, and they haven't established that pattern. So I guess it was kind of, certainly in my mind, and I don't know about Christine, but it was in my mind a lot, just the sort of recurrence of that and the thought of having to go back. Looking back was quite it was sort of, I suppose, hanging over us a little bit, just the worry about maybe it happening again and having to go back, because Christine was in there for all of those nights, and it was just seemed really unfair, because obviously the breastfeeding side, she had to be in there, and I was kind of in there all day and then had to go home. It was quite heart-wrenching for me to have to leave them both.
I can imagine, yeah.
So it's really quite a difficult time.
Professor McNamara, how long is the recovery typically from RSV?
Well, children actually, as we said, can get sick. Babies can get sick very quickly. Then they tend to have a period where they remain about the same for a few days, and then they also get better reasonably quickly as well. But actually, I don't know, I can't remember whether you said that your child had a cough or not, but the cough can sometimes go on for quite a long time afterwards, sometimes weeks. So yeah, it can take a while to get over.
Okay. And then you had another baby.
Mm-hmm. Yes.
Jude,
yeah.
And he got RSV as well, is that right? Could you tell us a bit about what happened with Jude?
Well, Jude was born in February in 2021.
Yep.
Yeah, and it was the height of lockdown. So even if it wasn't lockdown, we definitely would have kept him really close and not seen as many friends and family, because we were hyper aware of not wanting him to get ill, especially in the first month. So we kept him as close as we could, and we kept our daughter off preschool. But of course, in the autumn term, my daughter went back to preschool, and then he started getting all the bugs. And so when he was 6 months old, he actually got RSV as well.
Okay, and what was his experience of RSV like? Was he hospitalised with it? Or
his was actually much more straightforward, I suppose. I think, thankfully, our experience with Aria, actually, we were much more prepared. So I think we spotted it much sooner. We didn't have to have an ambulance. We went to hospital, got him checked out. And I think he was only in there about an hour. They checked all of his stats, and his breathing was okay. And we managed that at home. So yeah, thankfully, I think our experience sort of made us more aware of what to look out for and how to manage that better ourselves.
So you mentioned that Jude, he was born in February 2021, is that right? So my son was born in October 2020, so he's just a little bit older than Jude. And then in November, we went into that lockdown where we were locked down, I think, all the way till April with just some outdoor meetings. But I was very stringent because I needed my parents to help me, and I didn't, even on a walk, I didn't want to pick anything up. So when we came out, he hadn't been exposed to anything. We'd really been in isolation. And then a couple months after that, he got COVID, which I thought that was quite bad. But then around September, he got RSV. And I was like, okay, COVID really wasn't that bad because he got RSV quite bad. And I actually ended up taking him to A&E as well because I just wasn't happy with the way he was breathing. I remember it was like 1 or 2 a.m. and I just looked at him, I said to my husband, I said, look, I know it's going to mess up his sleep routine and everything that we've been working towards, but I need to get him up and I have to take him to hospital because I'm just not happy. So we took him, they checked him over, and we were sent home a few hours later. We were just reassured, gave him a bit of a fluid challenge. But yeah, definitely as like a GP and a mom, it's quite hard to remove one hat and to put on the other. Like I feel like there's definitely like a mix there. So I was really trying to follow my maternal instincts but also think about objectively as a GP what I would tell my patients. So it is quite tricky. It's a very, very tricky path to navigate.
It's difficult being on the other side, isn't it?
It's very hard being on the other side. You feel very vulnerable and you actually get an appreciation of how vulnerable your patients might be feeling. So when you're on the other side, you do definitely notice that. I sympathise with you.
I remember I was really comforted by the consultant who was treating Aria at the time, saying that when his daughter was the same age, she also had RSV and was in hospital for 2 weeks. And I think there was an element of me that felt really guilty for letting Aria get so ill. But of course, as that's completely irrational. But sometimes you do feel that as a new parent, and it's just really reassuring to know that it is just something that unfortunately happens. And it's then what you do about it. It's then trusting your instincts, having the knowledge to do the right thing to get them well again, rather than and thinking about the emotional response of how you feel about it in the instance, I think.
Yeah, I think a lot of parents do feel guilty. It's quite a normal thing to feel, but as you say, Professor McNamara has said as well, almost all children get it. Unless we live in like pure isolation forever, we're all going to get exposed to viruses. So I think there's almost an acceptance of, okay, our kids are going to get viruses, but what can we do to prevent as much as we can? And then when they do inevitably get the virus, what do we do? And that's the most important thing.
I think the other thing from my side, it was also work, having to take time off work.
Yeah.
So you feel a bit guilty because you're not maybe doing as good at the job as you could and things like that, taking time away. And ultimately the family always comes first, but it's kind of, the guilt and the you want to wrap them up and just protect them forever, don't you? And
Absolutely.
when they pick these things up and you aren't able to make them feel as
to
good
help
as they should, it's kind of, you do feel like you maybe could have done something differently or should have, so it's...
Amber, coming on to you, is there anything that you could suggest for parents, like any sort of methods of communication or giving information to parents about RSV that might help them to understand the condition a bit better, maybe before their children become unwell?
Of course, I think education should begin in the antenatal period. It would be really helpful if midwives, health visitors, doctors could equip parents with the knowledge of what common illnesses they could look out for, preferably without alarming them in doing so. And if they could have that information in a way that they could take away, they could refer back to, they could share with their significant others, that would lighten the burden on mothers especially.
Yeah, absolutely. I mean, I personally think antenatal is the time when, especially with your firstborn, where you've got that time, you've got that luxury, and you want to read the maternity records cover to cover. So having just a simple information leaflet in there could definitely help. So do you feel amongst the parent community and the mum community, parent community, there needs to be a greater awareness of what RSV is? Or do you feel that a lot of people already know what it is?
I don't think a lot of people already know what it is. I absolutely agree. There should be more awareness of most common childhood illnesses, and RSV is definitely among them.
Okay, and we've mentioned in terms of ways that we can raise the awareness, so antenatally is probably one of the best times. Are there any other ways that we could raise awareness? Through social media, through websites?
Absolutely. Social media, word of mouth. It doesn't seem to be something that parents talk about amongst themselves. And I wonder why that is. We hear a lot about meningitis, for example, but I don't think I've ever had a conversation with another parent about RSV, and so many parents must have children who have been affected by it.
Absolutely. I think we hear about chickenpox even, if you want to go for the more
All
mild
the
ones.
time.
Chickenpox all the time, meningitis, but this one that's such a common virus, I definitely think is a big hole in parent discussions and even in discussions between healthcare professionals and parents. So this campaign, I think, is brilliant at raising awareness of
Absolutely.
I completely agree with you. The figures are, sort of 1 in 25, 1 in 20, 1 in 25 children less than the age of 1 will come into hospital with bronchiolitis. That's enormous numbers, and it's and your point about parents not being aware of RSV. I mean, I talk to mums with babies with RSV on the ward, and they've never heard of it before. They've never heard of bronchiolitis either. So something needs to be done.
I suppose chickenpox has very easily distinguishable symptoms compared to RSV, which might be mistaken for a particularly severe cold.
Yeah, yes, yeah, it certainly could be in the early phases, yeah. Yeah.
And what are the main symptoms that, because you guys obviously are seasoned parents when it comes to RSV, but for anyone watching, what are the symptoms that they should be looking out for?
Generally, because the infection starts in the upper airways, they have a snotty nose, blocked nose, and then within a few days, they might start struggling a bit with breathing and with taking feeds, either bottle feeds or breastfeeds. And then, they might have temperatures, fevers, and then, and hopefully it will stay like that. But if they get worse still, I think that's when you start asking to see a healthcare professional, really.
And at what point would someone see their GP or call 111 rather than calling 999 straight away? What's the threshold?
That's a difficult one to answer, really. I mean, I think if you're worried as a parent of a newborn baby or a young baby, then I would seek help. If you don't think that the child is just right, then I would seek help. But if they start seeing more difficulty breathing, rapid breathing, temperatures that you can't get down, and particularly feeding, if not feeding, half as much as normal, then I think that's
dry nappies.
Dry nappies as well, yeah.
So we've spoken about in the first few months trying to protect your baby from the external environment. Are there any other things that parents can do to protect their children from RSV? RSV is spread by droplets. When babies or people infected with RSV cough, they produce droplets and get onto your hands. So regular hand washing, I think, is very important. So is there anything that, based on your experiences yourself as a healthcare professional or professor and parents, that you would also want to add? I feel like people should know about RSV. Any key takeaway messages?
I think anything that can increase awareness about RSV and about bronchiolitis would help. The vast majority of babies will get just a cough and a cold and that'll be fine. But for those few babies that need to come into hospital or get severe bronchiolitis, we need to raise awareness.
Absolutely. And I think it is really important to mention that the majority of babies who get RSV are fine. The symptoms are mild, they're managed at home. But as you mentioned, Professor, we need to just be aware of the fact that it can progress. Children can end up in hospital and even in ITU as well. So knowing at what point you should call for help, either by a GP or a health visitor or 111999 is the most important thing.
Yeah, I think from our perspective, knowing what to look for sooner, like you say, and maybe doing a degree of monitoring so you can sort of check yourselves That's something that we certainly didn't do the first time, which, looking back, I wish we did, because maybe we would have spotted it sooner and perhaps may not have progressed quite as quickly or as strongly as it did. But I think sort of knowing what to look for and then maybe tracking that and then making that judgment on, okay, now we need to take it sort of a step further and perhaps get a further, healthcare professional to sort of look into it. So I think that's kind of our takeaway would be to just maybe spot the signs a bit sooner and then sort of track them and monitor them to know if it is getting better or worse, and then sort of be like you say, when everything else is going on, it's hard to think clearly sometimes, as a new parent, just everything else to sort of take in and
Yeah, and I feel like sometimes parents might feel a little bit guilty afterwards that why didn't I pick this up sooner, but it's not. It's also our responsibility as healthcare professionals to arm parents with that knowledge and make sure that knowledge gets to parents as well, because we're not born knowing what viruses are, what RSV is, what bronchiolitis is. It's learned, so we need to. It's just about getting that information out there, which is the most important thing. And looking back, is there anything that you wish you'd done differently before your firstborn became unwell?
Yeah, I think with hindsight, I think kind of knowing where to look would have helped. We certainly didn't have the awareness or the knowledge of where to look. So I think a campaign like this is great as a resource to point parents in the right direction so that they can go. They know what symptoms to look out for, they know how to manage those symptoms, and they know when to potentially seek further help. So I think, with retrospect, I think knowing sort of a resource or a place to go would have really helped, and potentially helped to spot it earlier and manage it a bit better, I suppose.
Yeah.
I hope our viewers feel better informed about RSV and the signs to look out for. To recap, the main symptoms of RSV are cold-like symptoms, such as a blocked nose, a cough, or a fever, along with decreased activity and decreased feeding in babies. Remember, you know your own baby best. Always trust your instincts, and if you are concerned, speak to a healthcare professional. For more information about RSV and what to look out for, visit www.togetheragainstrsv.com.